Welcome to BW Healthcare World. My guest today is a practicing ophthalmologist from the UK, Dr. Aprajita Sinha. She is a graduate from Christian Medical College in Ludhiana and is also a pageant winner. And the discussion that I want to have with her is around the responsibilities of an influencer, especially when it comes to health and wellness. So welcome, Dr. Aprajita Sinha, to BW Healthcare World. It is such a pleasure to have you with us to discuss something which is extremely important in today's day and age. Before I move forward, Dr. Prajita, can you tell me a little bit about yourself? What is it that you do and your relationship with influencing?
So thank you, Harbinder. Thanks for this opportunity. And I feel really honored to be speaking with you today. So I'm an ophthalmologist working in the NHS. I work at Worcestershire Royal Hospital. And we've been living in UK. We moved here, with my husband, and we've been living in UK for the last 3 years. I was trained in India as an ophthalmologist, and that's when we moved to, of course, in pursuit of excellence for our profession. And apart from that, I'm originally from Ranchi, and my husband is from New Delhi. And basically my connection with influencing has been related to social media, of course, because I've been active on social media and I've just been trying to share some tips about related to eye health. And that's all I do, if that's called influencing. But my aim is to, provide that basic information that people have myths about, because I meet patients day in and out, and I know what perception they have about certain eye issues, and they're very basic. So I just want people to know what's going on so that it reaches out to everyone and that myth is broken, because it also spreads misinformation, which is not good for us.
So, Dr. Aprajita, you've been doing too many things. I mean, you are a practicing doctor, you are an influencer, you also you've been a pageant runner. How do you manage to do all these things? How do you manage your time without it being a burden on your main profession?
Thank you. Yeah, that's a very interesting question. The key to managing everything together is, of course, prioritizing and time management. And I do realize that what I do is extremely precious, and whatever else I do apart from being a surgeon, I don't let that affect my profession, of course, which requires a lot of dedication and attention while I'm at work. But I've always been sort of an all-rounder since school, and I've been interested in dance, sports, and all other extracurricular activities that you could think of, debates. So that's the kind of upbringing that my parents ingrained in me, and I think that is what I just carry forward. Even though I keep doing what I do, I tend to get inclined towards other things, because other things, as I find my interest there, and that is the kind of thing that peace brings peace to me, I would say. I've always been also sort of enticed by glamour. I was into fashion. Despite being a medical student, I would still follow fashion magazines and try to keep myself updated with the latest what was going on. So it's just, how you are and what you are just gets carried on later on in life. That is all I would say. I haven't been trying anything. It's just happening spontaneously.
That's very beautiful, because general stereotype is that if somebody is a doctor, the person is very, very serious and unglamorous world just because of their working in certain specific environment at work. So I'm so glad that you are an example of somebody who's in a very serious profession, but at the same time has a personal life which is more keenly following glamour as well. So brilliant combination, Dr. Prajita. Now, what I really want to bring up today is there's been a recent news about the government asking for mandatory display of qualifications from health and wellness influencers, specifically people who are doctors and an influencer. Do you think this is a welcome news? Do you think it is the right thing to do?
Yes, I think it's absolutely a welcome news, because medical knowledge is backed by a serious research and publications that has gone for years behind it for just one treatment or one eye condition or just one disease. Okay, it's not been just popped out in a day, and someone just medical knowledge is not about reviews, it's not based on reviews, but it is based on research. So it's important that misinformation doesn't spread about diseases, and people know the real facts. And I feel, of course, because social media is a huge platform today, and it's absolutely all right, people promoting their brands and things and talking about health and wellness, which everyone should be aware of health tips. But nushkas cannot become medical advice. Okay, that's what I feel about it, that it's good to be indulging in certain home remedies or certain products that are herbal or things like that. But again, when it comes to, if you have an eye pain someday, I would say you should see a doctor and not just resort to a nushka, because that could have a serious implication on your eye. And that is how I feel, it's important that somebody who's talking about health and wellness is also certified enough, so that it doesn't cause any harm to someone. As long as you're benefiting people, I think it's good. But as long as any harm is caused even to a single man out there, then that is something that we need to ponder over.
Right. So, Dr. Prajita, when we speak about healthcare and wellness, healthcare definitely needs to have qualified doctors who can bring out that information and share with the world, so that it comes from a trusted, qualified source. But when it comes to wellness or well-being, where it is beyond the medical care, there are people who get trained into these small courses on food, nutrition, yoga, exercise, etc. And then they start sharing information with the world. And because of their fan following, because of people who trust their ability to do something, they trust that whatever they say will also be applicable to us. What do you think is the responsibility of such kind of influencers who may not be qualified by studies, but by these small courses, which may or may not be recognized? They may be doing a great job, but what is their responsibility to the world?
I think it's a huge responsibility, because you're talking about health and wellness that deals with people's lives. And uh, it's not and wellness and health shouldn't be about becoming viral or having a fan following, but it has to be backed by information, and I feel that is why qualifications are extremely important, because they sort of they empower you with the fact that you can go out there and talk about it, rather than just being a layman about it. Like, for an instance, during COVID, you would have received several forwards about garam masalas
Absolutely.
and adrak and things like that, and tulsi ka kada, which are good. Of course, I'm not denying the fact that they do have benefits related to health, but they neither have a prophylactic implication with COVID, or can they treat COVID. And I was scared, because social media works on an algorithm. It picks up things that are trending, and that have the propensity to go viral, and especially with people who have a huge fan following. And so during COVID, there was a lot of misinformation which was trending. And of course, coming from the kind of culture that we hail from, we've got a very ancient background. And of course, we've been talking about herbal medications and things like that, which are good. I'm not denying. But again, when it comes to tackling with an emergency, with an acute condition, it's the medicine, the actual medicine, that can help someone, and not resorting to nushkas. And COVID was one time that I think taught us that it's good to boost your immunity with everything all the time, but that immunity cannot help you survive a virus, okay, if it's really getting into your life. So that's what my take on it.
No, I think I completely resonate with what you're saying. I think we need to, one of the things I think the influencers need to do, people who are not qualified but strongly feel about or are very passionate about sharing what they do, is the fact that they need to let the world know that they are enthusiasts and passionate about spreading the word. But they should also have the responsibility to be able to tell their viewers, their followers, that in case of an emergency, do this, but do it under the guidance of a doctor. Go get the professional help before you start taking things in your own hand, because at the end of the day, each body is different.
Each body is different. Yeah, that's what we say all the time.
Yes. So I'm glad you brought this up. Aprajita, the one other thing that I'm seeing is that social media is growing today, and social media is having more and more influence. In fact, some statistics say that the influencer space on the social networks is growing by about, or is expected to grow by about 25% compounded annual growth over the next 5 years. What do you think will be the impact on the influencer economy going forward? Because this is turning into a profession in itself. People are going to be making money through this. So it's a second profession for many qualified people as well. What is your take on this?
Yes, absolutely. I completely agree that, it's influencing has become a profession, and because social media is very easily accessible. It's just a click away in your hand, and it's also very entertaining at the same time. So the way these datas and facts are presented in the form of reels and posts, it really keeps the viewers occupied, and that is how people get their following, of course. But this is going to grow, of course, in the future, because we are now becoming more and more digitalized, and everything is in the phone these days, on Google, on social media. In fact, we need to look up ideas for anything, we go there and we check that out. And of course, all these ideas which are there on social media, they pop up, and some of them could be right, some of them may not be backed by the right sort of information, but they're there. So and this is definitely going to grow, I think, especially with the younger generation being more and more bound to their mobile phones and things like that, the screen. This is definitely growing, and I believe the estimated economy, the influencer economy at the moment is about 1,275 crores, and that's a huge amount, and it's only going to grow.
Got it. And Dr. Aprajita, one quick question about your influencing. Is it just passion, enthusiasm, sharing with the world, glamour, or does it also contribute to your revenues?
No, it does not contribute to my revenues. I'm a small time influencer, I would say. I do it only out of passion, and I do it only because I know people have got those myths. Only that something, the kind of knowledge that I've gained over the years by meeting so many people and talking to them. So my aim is just to be there for people, genuinely helping them, genuinely letting them know that this is what happens, and this is how you need to stay in a follow-up with a condition, or go see your doctor for it. That's all my aim. I do not promote any brand over there, and that is not what I'm there for, to be honest. My job is pretty engaging, I would say, in that manner.
Right. Since we're talking to an ophthalmologist, I don't want to lose this opportunity to ask you some questions related to ophthalmology, since we are from BW Healthcare World. So Dr. Aprajita, sometime back we were speaking to a couple of specialists in India, and they had their view on teleophthalmology and how it could impact the future of making healthcare, eye care accessible to the world, and also to the interiors of India. What, according to you, is the future of teleophthalmology in the world, and specifically, what do you think it could be of use to a place like India?
So teleophthalmology essentially means providing eye services remotely. So I think it has a huge potential in a country like India, where the population is huge. And the government, of course, with all their efforts, is trying to cater to all of the population, but it's not possible because it's so huge, and to build up such infrastructure for health is extremely expensive. That is one thing we need to realize. And a majority of India still lives in rural areas. And I hope I'm not wrong when I say this.
No, you're
And
absolutely right.
tier one cities where they do not have access to tertiary healthcare. And with teleophthalmology, what happens is that we try to set up a vision center where you could have these scans, machines, and these optometrists and technicians working there who have a basic knowledge about these machines and certain eye conditions, so that they know how to pick up some certain problems, and they can connect with a doctor who's sitting in a city and send out their vision, their eye pressure, their visual fields, the images of the retina, the scans of the retina, or eye pictures. So it really helps the doctor to come to a conclusion many times, in fact, most of the times, because this is something we routinely follow in the UK, which I'll be talking about later. So, and the doctor can really decide whether there's a actual problem going on or not, because of course, as the medicine has advanced today so much, that we are definitely, as doctors, dependent on these investigations. And it wouldn't even be right not to resort to them when they have such excellent results in a patient's prognosis and treatment. So when a doctor can then decide the treatment, or they can just say that this patient just needs a follow-up, or they could come back after some time, after a few months, or they need to be treated urgently, or this is the kind of treatment they need, or they could be sent off a prescription. So it's really helpful. Somebody is sitting in an interior village, and if they have access to that kind of medical facility, that's what we need. And that's what we talk about when we talk about health facilities day and night, because people in the cities have access to all the doctors, and a doctor is just a click away. They can go to Google and find a doctor, the nearest available specialist. But that is not with the people who live in villages. They are not so tech savvy, first thing, and they do not have access to the actual tertiary center could really be far off from where they're living. And again, so coming to the UK aspect of teleophthalmology, because as you know, NHS is a government-based health service, which is provided to everybody free of cost here. So of course, and the population is again huge, okay, but we've got centers in every district which caters to all this population, which is distributed across them. So we've got teleophthalmology in place, which is routinely done, and we see a majority of patients, because not everybody has got a problem, or everybody who's got a problem can be picked up with the help of these devices and scans. And this is what is routinely done, especially with retinal and glaucoma related eye conditions, which are mostly based on investigations, and it's not easy to pick them up unless a scan or an image is performed, or an angiography of the retinal vessels is performed. So we do this day in and out, and it has excellent results, I feel, because these patients are then not lost to follow-up, because of course the waiting is huge, and seeing a patient face to face is much more time consuming, of course, because there is a conversation involved. And when you're viewing just the scans and images, you know exactly what you're looking for. And I think it's especially in a country like India, I think it's, especially with COVID, I think it's really caught up, which is a great thing, and it should just go on. That is what is needed.
Got it. And Dr. Aprajita, another burning issue today is eye care for children. And I see that because of the more screen time that children are, exposed to, because of their studies as well as gaming, they're facing they get eye issues sooner than later. What I really want to know is that, do you think this will result in more severe eye conditions? Would they face cataract earlier in their life as compared to what earlier generation faced?
Well, yeah, so that's again coming back to it. So screen time is not related to cataract formation, whether in children or in adults. It's a myth. Screen time is associated with dryness in eyes, tiredness, and you could have neck issues, and they've got visual problems related majorly to dryness. Because what happens when we are looking at the screen for a really long time, we tend to blink very less frequently. What blinking does is spread out the tear film over the eye, and it helps to keep the surface of the eye moist. But when we are looking at the screen, we are not blinking, the tear film, of course, evaporates and the eye tends to become dry. There could be redness, there could be itching, there could be tiredness, and you could develop a headache. So these are all the symptoms of the computer vision syndrome. That's what we call it. And of course, people who work on computers or with excessive screen time, of course, they come with these problems, and they can be solved, of course, with the help of eye drops. There's nothing, there's no research or data at the moment to back that this can lead to cataract formation, because cataract is a whole is a different condition altogether, which is caused by very different causes.
Great. And Dr. Aprajita, one more question I want to ask you related to lenses. And earlier on, lenses came in as one of those modern ways of avoiding spectacles if you had a number. If your vision needed to be controlled and corrected. Now people have started using lenses on parties, occasions, weddings. They're colored lenses, etc. And there are these conflicting thoughts on whether it is okay to wear lenses when you do not even need them versus it's okay to wear lenses. What is your opinion? Do you think lenses are okay to be worn, or is it a silent menace?
Well, there is again no clear-cut guideline to say that contact lenses shouldn't be worn, because as a doctor, I talk with what I've read in the books and the information that I've gathered, and it's not my opinion. So there is no actual guideline on who should wear contact lenses and who should not. There is, but yeah, if somebody who has no eye problem actually can wear contact lenses if they want to, whether these are cosmetic lenses or whether these are lenses with power. And as long as they know how to use them, because there are clear-cut guidelines about contact lens hygiene. If you want, I can talk about them, because that is what I try to tell all my patients, because people who wear contact lenses are at a risk of developing eye infection sooner or more frequently than others, especially when they do not follow the proper instructions on how to wear them and what sort of contact lenses to be worn. So it's very important that when you are going out there and buying a pair of contact lens for yourself, you have not just bought it by yourself, but seen a doctor or an optometrist to discuss with them whether that contact lens is right for them or not, and how to wear it, what precautions to follow while they wear it, and how long they can be worn, and what is their expiry. These are some of the very important things, because there's a very nasty waterborne eye infection called acanthamoeba keratitis, which can lead to a very aggressive ulcer in the eye in contact lens wearers, and which is not good because it can lead to a permanent visual loss at times. So it's very important that we are empowered yet backed by the knowledge. So anyone can wear contact lens if they want to. Awesome. Even a child as young as 10 years, I would say, as long as they're mature enough to understand how to wear it and how to follow those safety tips.
Dr. Aprajita, let me come back to the discussion that we were having regarding influencing. Now, the health and wellness sector are highly important in India. I know it is important throughout the world, but in India, it is more in rage today. And, you have very high viewership on wellness and well-being. According to you, what should be the minimum qualifications of an influencer when someone is talking about wellness and healthcare?
All right. When it comes to health, the minimum qualification, I think, could be a medical degree, as I cannot think of anything else, to be honest, because the information that you're spreading has to be backed by years of that information, which is there in the books, which is again supported by research, and not just, it's not a figment of imagination or an opinion, or based on reviews. So, but for well-being, I may not be the best person to talk about it, because I do myself follow yoga, and but I cannot talk about yoga as an influencer unless I've read about it. But I'm sure there are degrees related to yoga, meditation, and the other things like Reiki, and so I'm sure they have their own qualifications, which I'm not aware of, but it's important that somebody who is going out there talking to people, gathering that kind of attention, better be, accurate and responsible when they're doing it, because they're
Right.
dealing with people's lives.
Absolutely, absolutely. And you said that you do not charge anything, or you do not get paid for your influencer work that you are doing. You're doing it purely out of passion and enthusiasm, right?
Yes.
Even though you are qualified to talk about it and go express yourself and your knowledge. Now, what do you think about the influencers who are advertising various supplement brands, health products, and some of the times they are getting compensated, whether in terms of money or in terms of products, free products, etc. If you were to be in their shoes, what would you think would be the right thing to do?
If I was in that position, I would, of course, endorse something only that I was sure about, and something that I knew was correct, and based on my knowledge, that I've gathered for the last so many years, and not just because somebody, told me that this is good enough, or, I would read the ingredients, especially with these supplements, because they could have steroids, because the supplements are taken by a lot of people who want to bulk up, and steroids help with that. But steroids have some serious health implications when taken, against medical advice or without any proper information. So especially, it could lead to diabetes, it could lead to weight gain, it could lead to weakening of bones. So it's very important that if you ask about me, so I would never promote something out there, especially like a health supplement, unless I was quite sure about it,
Got it.
that
I'm,
this
I'm
is.
so glad that you brought this up, Dr. Aprajita, because especially the negative situations that could happen, you could encounter using these products, because they are being blatantly promoted without even understanding the ingredients. I mean, the people who are promoting this do not even understand the science behind what it is. So I'm so glad that you brought this up.
Yeah,
Another,
because
yeah, go
sorry
ahead.
to interrupt, because you'd asked about cataract, and I brought steroids up. So steroids can lead to cataract formation and rise of pressure in the eyes, just
Lovely.
because I'm an ophthalmologist,
No, no,
I want.
absolutely. I'm so glad that you're sharing this with us. And Dr. Prajita, now, when we look at advertising, now what happens is when there's an advertisement which is getting created, built, shot, it is in a very controlled environment. The advertising agency and the brand is cautious about the negatives of how the industry could respond. There's a professional environment in which things are getting recorded and then shared. It is in some form or the other regulated as well through an advertising bodies that exist and the media bodies that exist. But when it comes to an influencer space, all you need is this piece of device, and you start shooting a video and put it on there without anybody checking for its correctness, etc. What do you think could happen or should happen in the influencer space to bring in this regulation which forces people to use it responsibility? What are your views on it? Do you think there should be some kind of enforcement, or do you think what is happening is the right way to have unfiltered information go out and be shared with the world?
So if I think it has to be regulated. Honestly, that's my opinion and view about it. Because when we are talking about health and wellness here, and it's not just a packet of potato chips, okay, with different flavor we are endorsing. So it deals with people's lives, and what they are endorsing could have implications. And when they have an implication, they will have to see a doctor. That's not when, an influencer could come to rescue. So what an influencer is doing at home with just a phone, it's good, because it's their bread and butter, it's their profession, which is good. But they have to be extremely responsible with what they are doing. It has to be backed by knowledge, and not just Google information, because at the end of the day, if they are talking about a certain disease or certain health problems, they are only picking it up through Google. And so they have, it's not through a qualification. So
Absolutely.
it's important that they're responsible, and they are not doing it just out of compulsion, because they actually seriously know about it.
Got it. And Dr. Aprajita, before I let you go, one last question. And you are an influencer, you do not charge money for influencing as on date. But if you are in a space where you are somebody who's qualified with and trained as someone who can talk about healthcare, you know. Second is you have created your space and positioning in the social media space, becoming an influencer. There is nothing wrong in endorsing products if you're qualified to do so. What are the kind of products that you would be comfortable endorsing if you had this opportunity?
So if I was comfortable endorsing, I would endorse, consumer products, and rather than talk about, something that I wasn't myself sure about. Like I couldn't talk about a health supplement, honestly, because I'm not even certified for it. Even if somebody asks me about problems due to acne, or a cream that helps with acne, I don't think I would talk about it, because if I had acne, I would take opinion from my dermatologist friend, and not just self-treat myself based on my own knowledge. So it could be consumer products, like it could be an outfit, it could be a pair of shoes, or things like that, but not things that have implications on people's health.
So you would focus on influencing and endorsing products that are consumer products that have no health related implication. Yes.
Absolutely.
Yeah. So, Dr. Aprajita, it has been such a pleasure speaking with you today. You're in that sweet spot where you are a healthcare practitioner, qualified by education and training, and you're also influencing based on your personal passion and not just doing things just because you are in a position to do so. And, my biggest takeaway from this conversation is actually from your last answer, where you spoke about that, every consumer or a user or a viewer on social media must also take the responsibility of what they could land themselves into, to understand that everything that they are listening to, if they were to use it in their life, it could have an implication, could be positive or could be a negative one. But they must remember, if they have an implication, they will need to resort to meeting a doctor and not go to that influencer. So use social media responsibility is what I could gather from our conversation today.
Absolutely, absolutely. That's the take-home message for today, I would say.
Thank you so much for joining us, Dr. Aprajita Sinha. It has been a pleasure conversing with you today.
Thank you so much, Harbinder. And I feel really honored, and I think the pleasure is all mine. Thank you so much.
Thank you.